July is one of the busiest travel months of the year, and whether you're booking a theme park family vacation or hitting the beach for a long weekend, summer travel should be fun. But if you're one of the 40 million Americans living with migraines, travel requires careful planning. Joining us now is Dr. Fred Cohen, headache specialist, and Deshauna Barber, former Miss USA and Army veteran. Welcome to you both.
Thank you for having us.
Dr. Cohen, what are some migraine triggers that often happen during travel?
Sure. So Deshauna and I are excited to be here today in partnership with Abby to raise awareness about migraine and its impact on travel during Migraine and Headache Awareness Month. Now, migraine is not just a headache. It's a complex disease with recurrent attacks that has an incapacitating, severe throbbing like headache pain, but as well as associated symptoms like light sensitivity, sound sensitivity, and nausea. Now, unfortunately, many triggers of migraine are unavoidable while traveling. And there's other triggers as well, such as stress, dietary, food triggers, alcohol, smoking, sleeping too much, sleeping too little, as well as changes in weather.
Deshauna, you live with migraines and you have to travel frequently for work. How do you manage that?
Well, one thing's for sure, it's very difficult, as Dr. Cohen said, to prevent triggers, but I try to be as prepared as possible. So when I travel and I board an airplane, I try to make sure that I have dark sunglasses, I have earplugs, and of course I have my Ubrelvy medication. I was prescribed it some years ago, and I'm very, very, very appreciative of the fact that it eliminates my migraine attacks and the symptoms within 2 hours. And I always recommend that if you are someone that's living with migraines, that you consider consulting with your doctor to be able to find a treatment plan that'll be perfect for you.
And speaking of that, Dr. Cohen, what are some treatment options for migraines when traveling?
Sure. So as Deshauna mentioned, Ubrelvy is prescription medication used to treat migraine attacks with or without aura in adults. It is not for migraine prevention. In clinical studies, some people had pain freedom and most had pain relief within 2 hours. Now, unlike other older migraine medications, Ubrelvy works differently, that it targets a neuropeptide called CGRP, which is believed to play a role in causing migraine attacks. Ubrelvy can be taken at the first sign of a migraine attack, and trial participants took Ubrelvy up to 4 hours after an attack had begun. Now, do not take Ubrelvy with strong CYP3/4 inhibitors, as well as if you're allergic to it. In clinical trials, the most common side effects was nausea, 2 to 4%, and sleepiness at 2 to 3%. And I encourage all adults living with migraine to speak with a healthcare provider to find a suitable treatment option for you. And if you want to learn more Ubrelvy, you can go to ubrelvy.com for product and safety information.
And Deshauna, what advice would you give to someone who may feel hopeless when getting migraines?
Definitely don't feel hopeless. There are resources out there for you, so definitely consult with your doctor to be able to find a treatment plan option. And if you have any special events coming up or any travel planned coming up, to make sure that you set your appointment soon, because it's always better to be prepared.
Dr. Fred Cohen, headache specialist, and Deshauna Barber, former Miss USA and Army veteran. Thank you so much for joining us. And Deshauna, thank you for your service.
Thank you, Cindy.
Thank you for having us.